Let's grab the wit ball. I like the firmer of the two, but certainly if things are sensitive right now, use the softer. You're going to come onto your back. Knees bent, feet flat on the floor. We're just going to lift up and we're going to take that ball. We're going to start in our low back. Again, we did this in the class, so this should not be new stuff, but just as the quick reversion. So you're going to be just off center. You're not on your spinous process. You're just kind of in the curve of your low back on that left side, maybe an inch or two from center. Let yourself kind of sink down. You might not feel it a ton right now because we've got that arch in your low back. So then we're just going to start to tip your pelvis a little bit. You're going to rock your pelvis. So you go into a posterior tilt and then come back out of it. So press your low back down towards the floor and relax out of it. So the nice thing here is you're in charge. If you just move a half an inch and that feels like enough pressure, then that's where you stay. Good. So just getting some release. Again, I'm not right on my spine. I'm just off to the side. Breathing. And as always, you're in charge of this. You should always be able to breathe and relax into it. If it's too intense, it's making you brace and hold your breath. Ease up. Go more gently. Use a softer ball. Maybe you do this against the wall. This might not be what your body needs right now, right? You listen to it. So then you could also sway side to side. So I'm going to come into a little bit of a pelvic tilt, and then I'm just going to swing my hips off to the right. So the ball just swings out to the side a little bit. I'm getting in those erector spinae muscles, which run the length of my spine. I'm getting a little bit into my quadratus lumborum. Again, we go deep into all this in the class, but we're just kind of doing a quick pass through. This is really great to hydrate this tissue of our lumbar spine, get our thoracolumbar fascia loosened up. I'm going to move the ball a little bit lower. And then I'm just going to start to move all the way down into my glutes. So I'm just kind of working through this low back, top of my glute. So I just move it down. I'm going to keep kind of swinging my hips side to side, rolling around. Maybe if you find a spot that feels really tight, intense, good. I don't know how you describe it. Hang out there. Breathe. And then we're just going to work our way into our glutes. So think about the whole left side of your glute, right? From midline all the way out to the side of your hip. Check in with all of it. So maybe you're just sort of doing big motions where you're kind of swinging and rolling the ball along, and then you're searching for it. It's like, ooh. Or maybe you're remembering from when you did the roller. Like, oh yeah, it was in this outer hip or down towards my sit bone. Or we're just going to do a couple minutes on this side. So not super deep, not super prolonged. Like I said, if you feel like you're onto something and you need to hit pause and get in here deeper, great. But we're just sort of touching base with things. Remember, when you're in this middle and outer hip, you can let that left knee drop out to the side. Sometimes that gets in there a little bit deeper. When you find a spot, you just kind of breathe and melt into it. Moving it around. Breathing, softening. So just sort of touching base with that whole glute and hip, finding the spots, getting a little bit of blood flow, getting a little bit of circulation. Again, we're not going super, super deep. Just touching base. Rolling around all through that hip, through your glute. Good. Couple more breaths, and then we'll switch sides. Like I said, if you need more time, hit pause. Do a little bit more. Otherwise, this is a great just sort of quick check-in. So here we go. We're going to switch to the other side.